Dr. Mindy here, and on this video, I'm bringing more from my book, Fast Like a Girl, to you all, and I'm answering the question, do supplements and medications break a fast? If you are new to my channel, I just want to say welcome. I hope you'll find here that I am a woman on a mission. I may be a little obsessed with trying to get the world to fast because I've been in the health trenches with patients for over 25 years, and I can tell you that so many people, especially women, are feeling disempowered right now. We feel like we're out of answers, and fasting is an incredible answer for so many health problems. So I'm really excited to not only bring you all the videos, I don't even know how many I have here now. I know we've got millions of views and thousands of videos, but now you got 83,000 words, over 50 recipes, and a whole lot of information in my fourth book that will be available for you on December 27th. So head on over to fastlikeagirl.com and pre-order it, and let's talk about supplements and medications. And if you're new, hit the subscribe button and the notification bell.
Pioneer in the fasting
Do a long fast one day, your blood sugar going up and down. We're in it together. Okay, common question. I get this a lot. So let's just, here's what I hope you'll see in my videos is that I really want to teach you to think for yourself. Okay, I had actually a really fun story happen to me the other day where a patient went into her OB's office and she knew so much about her hormones, and she was able to really have an educated conversation with her OB, and to the point that she was like, the woman started talking to her like she was a doctor. That's what we want. I was so fired up when I heard this because I want, and I hope after Fast Like a Girl, I hope that every woman has the knowledge around her hormones and is able to use that knowledge not only for her health, but be able to have great conversations with her doctors around what her hormonal needs are. So as I answer this question with supplements and medications, I want to make sure you understand that I'm teaching you how to think this through for yourself. So I'm not just saying yes, no. I want you to be able to answer the question for yourself. So let's start with medications. The first thing I want to tell you on medications that's really important is that you should never alter your medication without the collaboration of your doctor. If your doctor is not willing to reduce your medications down or even adjust your medications, honestly, in my opinion, you get a doctor that can collaborate with you. And many of the doctors that send their patients here, I just want to thank you for doing that, because a lot of, like this book, I'm hoping this book is going to go in every doctor's office, that they're going to make this accessible to women, because I put the science in there, I put the application in there, and I want it to be a companion guide with your doctor where you two can work together to be able to figure out what medications are necessary and which ones are unnecessary. When it comes to medications, like let's use blood pressure and cholesterol for an example, it's really easy to turn to the medication first and ignore the lifestyle. But a lot of times we don't have to go on that medication if we fix the lifestyle. So there's sort of two paths that happen here. If you went into your doctor's office and they said your blood pressure and your cholesterol are high and it's genetic, and you're on a medication and you never addressed your lifestyle, I really want to encourage you to address your lifestyle, and I really want to encourage you to put fasting into that lifestyle. And I really want to encourage you to work with your doctor and then ask your doctor, after you've been fasting for a while and you're cleaning up your metabolic health, if you can get off those medications. So that would be the first thing I would say on the medication front. Now, if your doctor said eat this without food, then great, it'll work in your fasting window. If your doctor said take this medication with food, then go ahead and put it in your eating window. So follow whatever your doctor said. Will your medication spike your blood sugar is really the question. Is it going to pull you out of a fasted state? It can only pull you out of a fasted state if it spikes your blood sugar. Some medications will spike your blood sugar, some won't. So this is where something like a Keto Mojo, a blood sugar reader that you do the pin prick, or like a CGM, this is where that can really help. So know if your medication spikes your blood sugar. If it doesn't, and you're putting it in your fasting window, wonderful. But again, on the topic of medication, we need your doctor involved in that conversation. You can send your doctor to this video and have her work with you on it. That's totally a cool thing to do. And if you're watching this, I really applaud the doctors that are in that collaborative teamwork mode with their patients. So that's the medication. And by the way, just if you're like, well, I want more information, I put it in the book. I have a whole section on hacks that make fasting effortless, and one of them is fasting and medication. So there's more nuance in there. Okay, now let's talk about supplements. So this is what's interesting on supplements. I really want to emphasize that supplements should be exactly that. They should be a supplement to your lifestyle. So the way when I'm coaching a patient, I like to look at supplements is I like to come in, change the lifestyle, use supplements as a tool to get the body to heal a little quicker, but then start to take the supplements away so that we can just lean into lifestyle and use a supplement whenever we periodically need it to be there for us. Now, the body is always trying to bring itself to homeostasis. So if you've been on a supplement, the same supplement over and over and over again for more than 90 days, your body's adapted to it. It's not working for you anymore. So even if it's your favorite supplement, switch the brand, switch the style, do something different, get off of it, maybe for 30 days, and then get back on it. A supplement should be an addition to a great fasting lifestyle. So please know that. Does a supplement pull you out of a fasted state? Same rules apply as medication. Check your CGM, check your Keto Mojo. Take what you can do in your fasted state is do the blood sugar test. I outlined the blood sugar test in the book. Do the blood sugar test and see, does fasting raise, when you take your blood sugar, take the supplement, look a half hour later, is your blood sugar higher? If it is, then that supplement is pulling you out of a fasted state. Now, on the supplement front, I also want to say, this is personal preference. Some supplements really make me nauseous. Supplements that are packed with B vitamins really make me nauseous. So I can only do those after I've eaten in my eating window. Some supplements, like you're going to hear me talk a lot about aminos. We're really diving into amino acids in my Reset Academy, using amino acids in the fasting window. I had a great conversation with Dr. David Minkoff on the Resetter podcast. That will be coming to you soon. Talking about when we should be using amino acids. He is the leading amino acid expert in America. And so I wanted to bring him and talk about all the different nuances of amino acids. And amino acids are best done in a fasted state. So if you're doing Perfect Aminos, the powder, I'll leave links for my favorite aminos in the notes here. Then go ahead and do it in your fasting window so that you can make sure that you're adding in some nutrients and getting the most out of your aminos. Aminos are incredibly important because they are precursors to hormones and neurotransmitters. And I'm gonna let you in on a little secret. So if you've stayed this far through the video, you're gonna get a little cutting edge news that only the people in my academy know. But I just signed a contract, went into a new book deal for my fifth book? I'm done counting them now. My fifth book, and it's going to be on mental health for women over 40. And specifically, we're going to be talking about when these hormones go down, what can we do to make sure that the neurotransmitters don't follow? So remember that things like estrogen and progesterone are precursors for a lot of the neurotransmitters. So what I want to do with this next book is really build off the principles of the menopause reset, really teach you more about the power of amino acids so that you can keep your neurotransmitter production up as you move through those perimenopause and menopausal years. So that more info coming on that. But aminos are great in the fasting window. B vitamins, not so great in the fasting window, at least that's what I have found. So a lot of nuance in that answer, which is why this isn't a 2-minute video where I'm just like, hey, do this, don't do this. I want you to think through this for yourself. And those of you that are leaving me great comments on this channel, I just want to say thank you. I'm reading them. My staff sends me some of their favorite, and I'm now highlighting them on my videos. So if you have a great win, specific to this, to what I taught you today, please put it in the notes. But I want to give a shout out to the Toronto girl who just sent this to me a couple of weeks ago, and it says, I've been doing intermittent fasting since 2021, and she is down 40 flippin' pounds. There's just nothing. There's nothing that I've ever seen help people lose weight like fasting. It just blows me away. If you have great weight loss results, put it in the comments. And she's like, it's definitely part of my lifestyle. And then she goes on to say that she's been following my formula. She's been learning to fast like a girl. So that's the magic formula. And that it's been awesome. She's on day 17 of my cycle, and I'm currently on a 72-hour fast, 30 hours in. And once I'm on day 20 to day 31 of my cycle, I'm going to go down and shorten my fast, because she's an expert faster, to 16 hours. That is fasting like a girl. That is knowing when to pull out a long fast, when to go to a short fast. That's what I'm teaching here. So Toronto girl, thank you. You really warmed my heart. This is why I do what I do. Fasting like a girl is the path for women. This is how we fast. And I put the formula, and it's in the book, and it's all based off of those of you that have left amazing comments like Toronto girl. So keep your comments coming. Let me know if this is helping, and thank you for the pre-orders. The more pre-orders we get, the more we send a message to Amazon, we send a message to the book stores, we send a message to the bestseller lists that women want this book and that this book matters. And the more that those places see that this book matters, the more they will open up their platforms to show this book to more women, and we can change more women's lives. So as always, from the bottom of my heart, I love, love, love being on this journey with you. So grateful for you all.